It's time for another carrier product update. Tune in as we talk directly to the carriers about their new plans, any new network options they have, or which plan designs offer the most savings, and learn about the tools and resources they offer to help you generate more business. Visit our website to learn about all of the carriers we quote in our Carrier Product Update series. I'm Jason Powers, and I'm joined here by Michael Margerio, Executive Director of Sales and Account Management with United Healthcare. Welcome to our Carrier Product Update series. This is a special one. This is our Q4 Kickoff Summit, and everything that we do with United Healthcare, to have you here live in the studio is a real treat. So thank you for being here today. It's a hot one outside.
It's warm out there, but thanks for having me. I appreciate it.
So we'll get right into it. You have a lot to cover.
We do.
There's a lot of really exciting stuff going on with
There's some
United
cool
Healthcare.
stuff happening.
So we'll jump right into it.
All right. Well, the first thing that we're talking about these days is our ancillary product portfolio. So we have a whole range of all of the, if you want to go forward one, Bo, we have a whole range of everything that you might need to give to an employer. So if you go forward one, you'll see on the left side, dental and vision, both of whom have broad national networks. I think we're in the top 3 of largest national networks for both of those products. Vision is especially cool. It's half retail and half private, so you get a pretty good mix for your employees. And then, of course, basic life and AD&D. We do both short and long-term disability contracts, and we have a whole suite of worksite products. So you see there on the right side, critical illness, accident, hospital indemnity. Those creep up into some of the larger group, but if you have a big group, we'll sell you group pet insurance.
United's in the pet insurance?
We have a partner in that space, and the only unique thing there is it requires a P&C license because life and health doesn't cover your pets.
Did not know that.
But it's been very popular.
In the
last couple of years, as you've seen, a lot of employers looking for an extra benefit to throw at their people, and pet insurance has been very, very popular.
Is that 100 plus? I'm just curious. Is that 100 plus eligible?
Eligibles, yep.
Got it.
That's right.
Got it.
Yeah.
All right.
Yeah.
Good to know.
Yeah. And then, of course, with those, if you move forward, one of the things that we do is we do bundling and packaging. So put your medical and your dental together, put your vision with us, and you get some benefits of both simplified administration, one bill, one point of contact, service teams, but also some savings like you would expect when you put 2 or 3 lines together. We do that both in a credit that you can see there, and then if you move forward one, there's some bundling that will last into perpetuity as long as those lines remain in force. And so what you're seeing there is for 2 to 50 size groups. For 51 and above, there's a similar but slightly different package of bundling. It's been very popular.
Is that the difference in U-bundle and
That's right.
package savings?
That's right.
Got
Yep,
it. Okay.
U-bundle, that's right.
Got it.
Exactly.
Makes sense.
Yeah.
And so then I saw this slide and I went, okay, so I know groups in the past have had some challenges with the integration with Navigator, but you have this coming now.
This is coming. I think this is exciting. Any agent with an Employee Navigator license, we were running some pilots in different parts of the country, and we've expanded that to any agent that has an Employee Navigator license. So what we've done is, if you move forward one, Bo, there is, today we've got the data exchange. So it's back and forth. You don't need to send file feeds. You don't need to do any of that. It makes it way simpler. And then launching here shortly our full API integration, which eliminates all of the interplay. Everything goes real time into our systems. A couple of unique things with that, of course. When you think Employee Navigator and EDI feeds, you're talking about back-end systems. So things that we probably don't talk to you a lot about, the name of the platform and those sorts of things, now are kind of getting exposed, which is a little bit, a little bit weird. People don't know what Prime and some of those other platforms mean. So on the next page, you see some of the list of that. I think it's in the middle of the page. Prime USP Facets, maybe nobody knows what that is, but those are the underlying systems that our medical and ancillary programs are built on. The other thing that I think is, it's intuitive once you understand it, but it's counterintuitive at the beginning, that last bullet point there. We can't do this for new business because the way Navigator's system works, it has to be built in our system, it has to be built in their system, and then everything connects. So for a new business, we still have to install the group, and then the automation happens.
Sure.
Where we've had this in place, it's been spectacular. Saves a lot of time and effort and energy for the agent and for the employer, and avoids all of those hassle phone calls 4 months later. Oh, we forgot to add this dependent. Can you make an exception? And just makes it a lot smoother.
If it's in your native system in
That's right.
Navigator, it's
Yes.
going to be in the
Yep.
system in United Healthcare.
And-
And so they're just reconciling.
They're reconciling, right? And there's some build out work inside of Navigator, but if you have a license there, they have people that can help support that too.
Yeah, for sure.
Yeah, super excited about that.
That's big.
That's mostly, I think Navigator's business is 92% under 100, so that's where we're focused as well. We can do EDI feeds with a lot of vendors for 100 plus business, but this is kind of exclusive to that under 100 space.
Yeah, so it helps fill in some gaps for me because this year we actually ran into a group with an agent that the group really wanted to have some sort of integration, and in the past they were always told no.
Right.
And
Yep.
this explains
Yeah.
a lot of that. Well, I mean, there's no way they're going to do. United's going to do this for this size of a group, but you did.
Yeah,
It was,
right.
It
Yeah.
totally changes their habits as a group and where they go and how they integrate with United Healthcare.
Yeah.
So
Navigator's been a good partner, and I think nationally they're our biggest partner in that space, which is how we decided to start with them. There's probably some more coming down the pike too.
that's great.
Yeah.
So then moving on to United Healthcare level
Level
funding. So I
yes.
can't say All Savers anymore.
You can say it because the change was as of March of 21.
So we still have a
Right, we started writing everything level funded into the new, I call it like a front door, it's a new entry point into our system. And so you can see on the next page that everything that exists today on All Savers will stay there until next spring, waiting until after January, of course. Next spring, we will start taking those All Savers cases and they'll renew to United Healthcare level funded. This has been by far and away our best-selling product in the under 100 market. It's been competitive across the country. We've got a great size book of business going into it. A couple of things that I think are unique about ours is it's a 1260 contract, so a long run out, really hard to get a claim outside of 60 months, hopefully. But we see a lot of them that are 1224, and you can get some exposure and some gaps there. So really like that feature. The move to level funding has also then brought us, those members have the same experience. So not just the same portal for the broker and the employer, but the same portal for the members.
Yeah.
They get the same tools, the phone app and the transparency tools and all the things that people have come to expect. So been very exciting. The other thing that you see in the middle of that page, we're rolling it out down to 2.
Do you see that?
Yeah, how about
Down
that?
to 2.
Down to 2, and there's some, pretty detailed caveats on the
Sure.
participation
Sure.
rules for that 2 to 5 space. But that's listed out there, and then it stays at that 50% for anything 9 plus. The other thing that I didn't remember to get on the page, right now we're doing GRA or GRX underwriting down to 10. In Missouri, that's going down to 5.
I saw the
So
announcement.
that'll be
Yeah.
exciting too. I think that makes that space just that much easier to.
It's
to
gonna
integrate.
it's gonna make it hard. I think it's just gonna make it hard for anybody else to really compete in that
Yeah.
space with United Healthcare.
Yeah, been very happy with that. And then last thing to point out there that has also been exceedingly popular is the 15-month contracts that we've been putting in place.
Yep.
A lot of times the goal of that was just for all of us to get the volume off of January 1st. And it's worked great, but now also we spread the volume out to 3-1 and 4-1. And
So
we've
you're the guy I
extended
can
the
complain
season.
to that
That's
I
right.
don't get a
Yeah,
break after
Right.
Q4.
It doesn't end anymore.
Yeah.
That's correct.
Yeah. The one thing I think that is important for brokers to know on a 15-month contract is that it does move that open enrollment period.
That's right. Yep.
To that whatever that 15th month is.
Yep.
It's not you can't open enroll at the original
Correct.
effective
It
date.
moves the whole thing.
Yeah.
That's exactly right. Good point.
Yeah.
Yep.
That's exciting. I think it's exciting in the 2 to 4. I know it's hard to get excited in that 2 to 4 space, but there's a lot of groups that are not being served in that
That's right.
space
It's a gap.
with a competitive
I
product.
think
And
that's
the
right.
pricing in some of the ACA plans for families has gone up to a really high number where it's about a mortgage payment for a really nice house in Leawood.
I think that's right, and unfortunately, I think some of that's still going to exist, right?
Sure.
Level funding isn't right for every employer, and there's an underwriting process to go through. Try to make that as easy as possible, and I think that down to 5 will help there. But yeah, it can be a really good solution for a lot of
Yeah,
folks.
for sure.
Very excited about that.
So then, and Mark brought this up in one of our conversations, and he acted like I should have read it in a broker blast. What's Mineral?
Mineral used to be called Think HR.
Okay.
And so one of the things that we've been getting questions on as we move fully insured employers into level funded is, hey, I need help with some of this HR stuff, the compliance stuff. So on the next couple of pages, Mineral, we've embedded it in our 2 to 100 level funded groups. And it's at no cost to the employer. So truly embedded in that. It's starting October 1st.
Wow.
And they get a bunch of support, including dedicated call center support. They can call a certified HR representative. The booklets have been exceedingly popular. Build your employee handbook in a compliant fashion, especially think about it. You've got 15 employees in 4 states. You got to have compliant handbooks in multiple states. Mineral helps with all of that. And we built a suite on the next page. We built a suite with them that is a little bit different than what they offer out in the market. So there's a couple of things there. That living handbook there towards the bottom is really the one that has been getting the most eyebrows raised, because a lot of support for employers that didn't have, probably not only did they not have the resource, probably weren't compliant in certain circumstances. And we're trying to bring that to that space. That's
Not just the builder, but with United, with the United offering,
That's
they get it in multiple states.
Yep.
And Spanish available. That's yeah.
So this is rolling out October 1st inside of anything new level funded, anything renewing All Savers under 100. This will be embedded. Yeah.
Wow.
And Mineral has a team. They will reach out to the employer. There are certain circumstances that they already have Mineral. Doesn't change anything. They won't get a new login. We're not duplicating anything. So I'm trying to make it easy for folks.
Sure. That's great.
Pretty excited about that. That's been well received as well.
And then I saw this one too. CareCatch talked to me. I've seen some similar programs stand alone, but this is now integrated into the United Healthcare deal.
The first thing to say here is we've had this for a couple of years. It was 100 plus.
Okay.
And so we've moved the threshold down to 50 plus. So I think that's exciting. It's worked pretty well. The way I like to tell people to think about this is it's a limited use HRA on a card. It's designed for specific needs, and what we're trying to do is remove hurdles for people who are not going to get their care because of that $40 copay or $80 urgent care copay or whatever it is. So driving them to quality providers using our premium designation. So it's for use at premium designated primary care docs and specialists only. Can use it at urgent care and then virtual visits. It doesn't cover your deductible. It doesn't cover your emergency room. And it's really designed to drive people to get to the right provider in that moment. Where we've seen success, if you move forward, you can see some of the places that people have started using it on their primary care office visits primarily is what's been happening, and then virtual visits and urgent care. There's some data that shows if you get people to the right place up front, I think we all know this, right? Go get your preventive screen, go to the urgent care, you save going to the emergency room, and you save that $5,000 or $10,000 or $20,000 claim. So I think if you go forward a couple, you can see where people are using it mostly. Premium care physicians, behavioral health, virtual visits, and then urgent care is last. But this has been really, really well received. The people who have it, love it, they get to use it. There's not necessarily a target client, but where we've seen the most success, the most uptake is if you got an employer that has some lower paid employees, and they really would struggle with the doctor's office copay or the urgent care copay. We've seen school districts, teachers.
Where's the funding come from on the back end? You mentioned it's kind of like an HRA.
Yeah. So it's pre-built into the plan. It's a buy-up. In 51 to 100, we're embedding it. In 100 plus, it's a buy-up. So it's got a little premium increment. It's under 1%. And it's the $200 for an individual, $500 for a family. And that rolls over if they don't use it in a year. I think there's a max of 2,000. But as long as you stay on that CareCash compliant plan, can't use it with an HSA, of course, because it's a first dollar benefit. But as long as you stay on that that CareCash compliant plan, the dollars in that can roll over year to year and helps prevent that upfront sticker shock of people not wanting to go.
So that United Healthcare is funding.
That's right.
It's not through premium.
It's funded through your premium, but it doesn't result in any taxable consequence or anything like that. And it's limited at the point of sale. You can't go swipe it for a pack of cigarettes or whatever. It's limited to those 213D expenses. So it's worked really well.
That's interesting.
Yeah.
51 plus market for sure. All right, so then talk to us about zero out of pocket on certain preferred drugs. That's something new too.
This is something new. This is January 1st, and it's inside of our fully insured business, and it has to be approved by insurance regulators. So be interested to see if any state Department of Insurance don't want us doing this. Stranger things have happened. But assuming it's approved everywhere, well, a similar story, trying to eliminate hurdles for people to get the drugs where we all know paying for the drug is much cheaper and much healthier than not being compliant, and now you're in the emergency room. So preferred insulins, the key to this is they're on a preferred list, right? Preferred insulins, both short acting and long acting, and then you see a list there of a couple of emergency use type drugs for hypoglycemia, super low blood sugar, those sorts of things. And some of the other ones in the overdose, naloxone, a lot of police departments keeping that on hand, a lot of use there. So trying to remove barriers for the things that we all know, if you don't stay compliant, it ends in a health disaster and a much larger cost, right? Yeah, we all talk about it in terms of cost, but a better outcome for the individual as well.
Yeah.
And that's everything 2+, everything fully insured, starting January. Yeah.
Wow.
Yeah.
All right, and then the next one I've seen, I've seen this pop up on Facebook. I think I've seen it pop up in LinkedIn, but this is probably the first time I think I've actually talked about it. What's the partnership with Peloton?
Yeah, so we have a national partnership with Peloton. In addition to their famous bike, which you don't need to have to use the app, they've got a membership where you can access their workout instructors. So I think partially they're famous for their bike, and partially they're famous for their classes. This gives you access to their online classes and their coaches. You can either access them live as they go or access the recordings. They've got a bunch of different channels. And so it's a 1-year membership. It's built into our fully insured business. It's not in level funded yet, and it's a buyout for self-funded groups. And you don't need that. You don't need the bike, but you can go do the workout. So I've seen people that they have their own equipment, but now they got a coach. And the old line, if you want to, if you want to go far, go alone. If you want to go fast, go alone. If you want to go far, go with somebody else. You surround yourself with other people doing the workout, and your outcome is better.
Yeah. That's absolutely true in my household.
Yeah, for sure. No doubt about it.
And then Apple Fitness.
Yeah, similar, right? So some people like Peloton, some people like me have an Apple Watch, and for Apple Fitness, you do need the watch because that's how it connects to the tracking, of course. But again, it's the same thing. It's a 1-year membership, and we've been doing this for a little while. So this is an extension. If you already have that 1 year, you can add another year.
And this is on the fully insured.
This is in everything fully insured 2+.
2+, not on the
That's
level
right.
funded.
Not on level funded today.
But a buy-up on the self-funded large group.
That's right.
Got it.
Yeah, a couple of those are the fun, easy ones to talk about. People like to see that, and I actually think, all of our clients, all of the employers, we go into open enrollment meetings and we tell people to get healthier, but we don't give them the tools to do that, and we tell them their rates are going up and they don't see any value in it. This is a nice to have, but can help support that too.
Yeah, for sure. So then My Script Rewards, I think, is your next one. What's that?
This one is hyper-focused. This has been in place for a few years also, focused on HIV medications. What we've seen is people can get on a medication and those prices can go through the roof, and we're constantly negotiating to get a preferred price on a specific drug that's effective. And what we found, of course, is you give people an incentive, you can change their behavior. So this is the same thing. For really, you see that three very sort of narrow focus, but giving them up to $500 if they switch to a preferred medication. So they get $250 up front, they stay on it for 6 months, they get another $250. That comes in one or two different forms. If they have an HSA with us, with Optum Bank, it goes straight into their HSA. If they don't have that, they get a debit card that looks a lot like that CareCash card we talked about. It's a limited use 213D debit card.
Got it. And then again, this
is everything fully insured.
everything fully insured.
That's right.
Wow.
Yep. Yeah, I like this one, and I'm trying to support people who have high cost drugs and remove barriers.
Well, the MS drug, I know the MS drug is one we keep running into. The growth hormone one,
Yeah.
that's another one we keep running into. So this is expanding into those now. You've had
It's been in HIV for
Yeah.
a while. Yeah,
Yeah.
3 or 4 years in that space.
man, you guys are just cranking out new stuff.
Yeah, a lot of cool stuff. Trying to, I think we all realize you do the math. Getting people healthy costs less than paying for their claims.
Right.
We don't know that. It's not as easy to do as that, but it's the right thing to do.
Yeah.
Yeah.
So then, point of care assist.
Yeah, I like this one. This is something that you would never see happen. This is a behind the scenes. It's something we've been working with our network providers for a long time. They want more information so that they can support their patients in making better decisions. We started this with pharmacies. So if you move forward, you see a bunch of bubbles on there, and one of them is called Pre-Check My Script. And it basically puts into the provider's electronic medical record all of the information we have on their patient. So think of the average provider. They may or may not know if their patient went and filled that script. They don't know if they were compliant with the doctor's orders, so to speak, and this tries to give them some line of sight into that. And I'll show you some data in a second, but that Pre-Check My Script, if you move forward, it's one of those bubbles that you see there. It was so successful, then providers said, okay, we want more. So we're trying to expand it to other prior auths and other eligibility stuff. They can see other claims. Think about a doctor's group, and the primary doc sends their patient to see a specialist. Well, what if they went to a specialist outside of that system's four walls? The doctor doesn't know if they ever went to the specialist,
Right.
and this attempts to close that gap a little bit. It's been very well received. Again, you would never see it, I would never see it. The doctors, we've been telling them for years, you can get this, go log into the United Healthcare portal, and they said, yeah, cool, thanks United, I'm pretty busy over here. Can't you put it in my daily workflow? So that's what we did. We went out started with the two big EMRs, Epic and Cerner,
Yeah.
and we integrated our data into their daily workflow. So
Wow.
when they're sitting there talking to you as a patient, they now see more information about you, and hopefully you and them together can make a better decision. Think about, doctor gives you a prescription, you have no idea if it's on the preferred drug list, you have no idea what the copay is, and maybe you had your phone app and you did some of that work while your doctor was talking to you, but now they get to see it too, and it just makes it much more powerful.
Wow.
Yeah.
That is because that's one of those concerns in a doctor's office is that
They don't know.
I don't know what
Right.
depends on your insurance.
Yeah, that's right. And that tier 3 copay can be prohibitive for
Yeah.
people. And so if in the moment they can prescribe something else, it saves everybody that trouble. The other thing it does, if you move forward one, you get a little bit of a view of what it looks like to the provider. They kind of see, we throw in modules, they can see more data.
Yeah.
In this case, that patient, they went to the ER and the doctor didn't know it, but now the doctor sees that in the morning when they're reviewing their patients for the day. So empowers them to give better care. And then the last detail on this is some of the outcomes on the next page, which that one that I think is most interesting, frankly, is that fourth one down, 50 minutes. We can save the providers and the pharmacist all time and the patients when there's still drugs need prior auth, but you can do it there through the system and it'll either go through or not, so you know in the moment.
Yeah.
Saves the patient from going to the pharmacy, the pharmacist saying, well, we got to call your doc. They have to fax in this paperwork. That takes a day or two. That doesn't come through. It doesn't get approved. Now the person's not taking their med. The doctor's annoyed. The 50 minutes saved, that's before, there's even a complaint to HR and they call you and me. So that it's been really fantastic. And then I think the last one there too, $415. That's a big number. And that's what we've found so far using this system. If they switch from tier 3 or a non-preferred drug to a preferred drug, it saves the plan the $415. So this is one of those things, like I said, works in the background.
Yeah.
But
this isn't
but
plan
just-
specific.
No,
this
it's
is
not
your
plan specific.
network.
It's
This
any
is
United
things that you're
Healthcare
doing.
patient, any of our TPA business through UMR, all those, for those providers, they can see all of our data for that patient.
Yeah.
And it just makes their experience better. It makes the patient experience better, even though they don't know it's happening.
Wow.
Yeah, I love that one.
Wow. And we'll put just so agents know, we've got new product grids on the
Yeah, good.
small group side. We've got product grids for level funded. We've got some other marketing materials that we'll put out on the site so that they've got downloadable content. But this is probably. I've been through a lot of different 1-1 cycles with United Healthcare, and there's so much
There's
going on.
a lot to keep track of, but I think it's all good stuff. We've got more coming out, and sometimes hard to keep up. Get a fire hose to control it.
Well, Michael, I appreciate you being on. Any final parting words for brokers? They're getting ready to close up shop for the day and head out to sell tomorrow.
Head out to the heat that is Kansas City. I think we want your feedback. What else do you want from us? I always want to hear that, right? We think we've got great solutions and great products, and that generally proves out to be true, but I always want to see what else is out there that people are interested in.
You heard it from Michael. If you've got ideas, he'll take them.
For sure.
He'll take them, and he'll take as many cases as you can write for United Healthcare
Also
in
true.
Q4. Same here.
Yeah.
For the agents out there, this closes up our carrier product updates for today. We appreciate you being on today. Get out there, sell some in Q4, and we'll see you next time.
Thank you for watching this edition of our Carrier Product Update series. Visit our website to watch other episodes.